This Week in Startups is brought to you by InVision. Find out why so many hot startups are using InVision to prototype, present, and collaborate on design in real time. Sign up for a 90-day free trial today at envisionapp.com/twist. And Walker Corporate Law, a boutique law firm specializing in the representation of entrepreneurs. Visit them at walkercorporatelaw.com.
Hey everybody, an amazing episode of This Week in Startups. Serial entrepreneur Miles Beckett is with me. He did a startup called Equal, which did Lonely Girl, if you remember that whole video internet sensation. He sold that company. We talk about YouTube and his pioneering work in the space. Then we talk about Silversheet, his new startup, which is in the medical space. He is an MD, actually. And we talk then about the future of healthcare and life extension and perhaps living to the age of 300. It's an amazing episode of This Week of Startups with a serial entrepreneur. You're going to love it. I've known Miles for a long time. Fascinating guy. Stick with us.
That's what it's all about, man. They said money is the root of all evil. What? Funny how it feeds my people. Yeah. We ain't gonna live like equals until we get the money, spend the money, and defeat you. Yeah. Money is the root of all evil. What? Funny how it feeds my people. Yeah. We ain't gonna live like equals until we get the money, spend the money, and defeat you.
Hey everybody, welcome to This Week in Startups, and we love talking to founders of companies on this program. It's kind of embedded in the name, isn't it? This Week in Startups. Startups are created by founders. Some founders create multiple startups, and those become some of the most interesting guests on this program, and today we have one of those serial founders on the program, and boy, is he doing two radically different things over the last couple of years. His name is Miles Beckett. And he did a product called Lonely Girl. You may have remembered this from 2006, 2007. He basically created the concept, I think you're pretty much credited with this, of viral videos on YouTube. And since that time, he sold the company that made Lonely Girl, Equal. He did okay for himself. Probably made a couple mil. I'm not going to say exactly. It's a little uncouth, isn't it? I started a new company. We're going to hear about it today. So please welcome Miles Beckett to the program.
Thanks, Jason. Great to see you.
It's good to see you.
Yeah.
We've known each other for a while.
Yeah, back in the Lonely Girl days.
Back in the Lonely Girls days.
Yeah.
Explain to people who don't know what Lonely Girl was, how you came up with the idea and what it was and why it was such a phenomenon.
Sure. So lonelygirl15 was probably the first web series on YouTube. The idea came to me because I was just obsessed with producing videos online, was really into YouTube at the time. And
YouTube had been around for a year, by the way.
Yeah, so I first found out about YouTube with a Lazy Sunday video. I think a lot of people kind of discovered it because of
The
that.
SNL digital short.
SNL digital short,
It was
exactly.
the first SNL digital short, I believe, wasn't it?
Yeah, it was one of the first. I think it was the first one. That's right.
I believe it was the first one
Yeah.
when Andy Samberg
yeah.
came to SNL.
Yep.
He had been doing his own little videos.
Yeah, The Lonely Island. They were an LA like comedy group.
Yeah.
And then the three of them were hired by SNL to do these digital shorts.
Yeah.
So someone like ripped it, put it on YouTube. Everybody saw it. And I was already into online video, but I was focusing more on video podcasting.
Mm-hmm.
And when I found YouTube, I was like, oh my God, I think this is going to be the platform.
Right. And it turned out you were right and wrong. I mean, podcasting has become big. We're sitting
Yeah, it
here,
has. Yeah.
but nowhere near the scale
Sure.
in a way that YouTube did.
I think podcasting, it's an easier way to build a loyal following.
Mm-hmm.
It's changed now, but at the time it was harder to monetize because you couldn't track the viewership as easily. I think it's a bit different now.
Still kind of stinks for viewership.
Yeah, it's not ideal. I mean, obviously with dynamic ad insertion through Flash on YouTube, like it's a lot easier for marketers.
Yeah.
So anyway, so I became obsessed with YouTube. And I was like, what can I do on YouTube? And I noticed that the most popular videos on YouTube were either things that were stolen from mainstream media,
Right.
or were these video bloggers.
Right.
And so the idea of Lonely Girl was, why don't we take a video blogger, but she'll be fictional, and we'll have this narrative evolve in the background.
Right. And there was something about the first Lonely Girl video that was viral, right? You had set up something, because it was...
Yeah.
Was it intended to be purposely deceitful and ambiguous as to was this a real person or not?
I think the right word is ambiguous. So,
Okay.
I mean, the way I approached it was, I was very familiar with like War of the Worlds and Blair Witch Project. And
Right.
so for me, it was more like, this is a new medium. People aren't used to watching narrative in this medium.
Right.
We're going to do it as if it's real and let the dice roll, see what people think. We're not going to say anything either way.
Right.
So we had tons of journalists that were reaching out to us, and we would just respond to them only in character. If they asked, like, is this a production, we would just ignore those emails.
So in a way, it was like the Blair Witch Project,
Totally,
which I think came out in 2000 or something.
Yeah, it was actually, I think, 98 because I was in college at the time.
Yeah, and that was very unique because it was one of the first films shot on digital cameras.
Correct, yep.
Which had come down to $1,000 or $2,000 for the VX1000 Sony or whatever it was.
Yep, that's right.
And they shot it in a very cinema verite, I guess, approach, as if it was real that they went to the woods and these crazy things happened.
Correct.
So it felt like a documentary in a way.
Yeah, it was like the found footage, one of the early found footage type movies. Yep.
And it made $100 million or something?
Blair Witch? Yeah, Blair Witch actually is it's the highest profit. It's the most profitable film in history because it was purchased for like 50 grand or something, or made for like 50 grand.
It was made for 50, bought for $1 million or $2 by
I forget.
Artisan
Entertainment.
Artisan,
correct. Yep, that's
which
right.
I don't even know if that's around anymore.
I don't know either.
Yeah, they did a couple of films. They did a film I was in called Center of the World.
Oh, really? Okay.
With Peter
all right.
Sarsgaard, which was done by Wayne Wang. But it was also during the same period where they shot on digital.
Okay, cool. Neat.
And that was a big, crazy concept of, hey, we're going to shoot on digital. And
it was very, unique at the time.
Yes.
Yeah. And it also had a specific look. Now it's changed where you
actually, Bennett Miller also did a digital film called The Cruise. Bennett Miller's The Cruise was another one of the digital cohort during that time.
Interesting.
And it was about a guy named Max or something, and he was a tour bus operator in New York.
Yeah, that sounds familiar.
Speed Levitch, I think his name was. Max Speed Levitch. But anyway, it was like one of those Sundance darling films. And did incredible. But of course, Bennett Miller went on to do Truman Capote and a bunch of other great films. He's a serious filmmaker. So what was the scale of Lonely Girl during that 2006, 2007, whatever time period that was? And when did people find out, and how did they find out it was what category did you put it in?
On YouTube?
No, what category? Is there a film category for Blair Witch Project? Is there like a genre?
Well, the genre of Lonely Girl was dramedy. So
dramedy,
the tone that we were going after was we wanted it to be a mixture of like Dawson's Creek and Buffy the Vampire Slayer, sort of in between, but shot, as if it was a blog.
But there was something about like one of the first videos that made it go viral. Like, was something happened in the background?
Yeah. So
what was that?
Yeah. So it started out where it was just normal video blogs, and then we had a video where there was a photo of Aleister Crowley in the background, who's this famous like occultist.
Yes.
So there was a lot of debate online, like why does this normal 16-year-old girl have this weird like cult leader photograph in the background of her room? And that was like the main plot of Lonely Girl, which was like this girl who appears normal, girl next door, actually has parents that are part of this crazy cult, and then her life kind of spins out of control.
Got it.
Yeah.
Interesting. I think that whole occult thing in L.A.
He was actually in LA for a while.
He was. And I think L. Ron Hubbard and him
that's correct.
were all living together and dated the same woman or something.
Yeah, that's right. Yeah,
there was some love triangle with them. I remember reading about this.
Yep, that's right, yeah.
I have a friend, Richard Metzger, who did Disinformation, who was really into this occult stuff. And this guy, Aleister Crowley, and L. Ron Hubbard. I think L. Ron Hubbard took a lot of influence from Aleister Crowley and building cults and the occult.
Sure, yeah.
To build a religion / cult, whatever you consider Scientology. You can debate it. You're not a Scientologist, are you?
I'm not, no.
Okay, good. I want to insult you about your religion. I have friends who are in the religion. I'm not a religion guy. But it was very sort of fascinating that he had studied that, and he'd also studied Freud.
Okay, yeah.
And he basically liberated a lot of the concepts from those two people to create Scientology and then mix it, of course, with his science fiction, which was,
the volcano stuff. I don't know. I don't know the details of it all, but there's something to do with volcanoes.
I watched the South Park episode. Figure it out.
That's basically the extent.
So when you look back on that period, what do you think was the driver of YouTube? Because it did feel like they were the outlet for content that media partners would not put online.
Yep.
But then it also felt like some other group of people, so that got them their first spike, but some other group of people actually sort of made it into a medium.
Yeah.
What do you think the driving force was initially, and what do you think carried it to now, where it's 1 billion people a month? I mean, this
Sure.
is
No, it's a
one
juggernaut.
of, I don't know, I'm trying to think of the number of services in the world that have over 1 billion users.
Sure.
A singular service with
Sure.
1 billion users. In the internet, it's probably 3 or 4. And then outside of the internet, probably McDonald's.
Right.
I don't know if Starbucks hits 1 billion customers a year.
Yeah.
I'm talking about unique
Who else?
customers. Who knows?
Maybe Coca-Cola.
Coca-Cola for sure.
Yeah,
Good
probably
one.
Coca-Cola.
Nike, perhaps.
Nike, maybe. Yeah.
That's probably it.
Yeah. I mean, it's YouTube's incredible. So, I mean, for me, prior to becoming a startup founder, I was like a super tech geek, super user of products.
Mm-hmm.
And for me, building businesses too, it really comes down to the product. So first and foremost, YouTube was far and away the easiest way to upload a video to the internet.
Right.
At the time.
At that point in time, what was the alternative to put a video on the internet?
You'd have to host it yourself, or there were like kind of crappy flash uploader websites.
You had to pay for them too, I think.
Pay for them too, right? They were usually cost
Pay
money.
by view.
Yep, that's right. Yeah.
Yeah, pay for storage.
Yeah, that's right. Yeah.
I mean,
so
YouTube sort of planted a flag and we're like, yeah, it's free.
they're like, it's free, and we believe that storage costs are going to keep going down.
Quite a bit.
Yeah, and we're going to leverage Flash, which at the time was, I mean, not super new, but newish. The video enclosure format for Flash was.
Yeah. No, it was very
So,
new. I mean, it was under,
yeah, I think
it was
pretty
under
new,
2
actually.
years.
Under
a year
2
old.
years, yeah.
Under 2 years.
years, for sure.
And they were the first people to combine free
Yep.
with Flash.
Yep.
And they also didn't. What kind of role do you think the concept of syndicating the content, being able to take that little JavaScript and put it on a blog,
is huge.
embeddable?
Yeah.
'Cause
Well, MySpace grew YouTube.
Yeah.
I mean, everybody had YouTube video players on their MySpace page.
Right. That seemed to be the big thing. So you wound up selling that company.
Yes. Yeah.
And the company did a bunch. Weren't you working with like every celebrity in LA or a lot of
A
them?
lot of them. Yeah.
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 I mean, a lot of the reality stars, I think, or
Yep,
like
that's
maybe
right, yep.
people on the WB. I have this like vague memory of you working and managing everybody's YouTube presence and websites.
That's
Was that
right,
a good
yeah.
business or?
Yeah, it was a good business.
Yeah.
Yeah. So our biggest name was Jennifer Lopez.
J-Lo.
J-Lo, we ran all her digital. We worked with Lauren Conrad from The Hills in Laguna
Yeah,
Beach.
very big.
Michelle Phan, we ran her website and all her social media.
Oh, really?
Yeah, the Fowler sisters from YouTube. So a lot of
She
big
did
people.
really well, huh?
Yeah, Michelle's done great. She's awesome.
All right, when we get back from this commercial break, I want to talk a little bit about how YouTube has progressed and
Yep.
the video space today, how you see it, and the sale of Equal. And then we're going to talk about your brand new startup, Silversheet,
Yep.
which is a huge departure. And don't say anything because that's a little teaser. We're going to be back with Miles Beckett on This Week in Startups right after this incredibly important message. Hey everybody, let me tell you a little bit about InVision app. I use InVision app all the time with my designer, my product manager, my growth team to share mock-ups of our products. We take those mock-ups and we design them and we send them to clients, to partners, to investors. And we say, here is an InVision link. Open this on your iPhone, on your Android phone, and you can click through and see what this product that we're making is like. And when we're building websites, hey, put your comments on there. We have a partner. We have a big Smart Camp thing going on with IBM, Smart Camp 2015. We can use InVision to share that website and say, hey, is there anything you want to change? And then have a threaded discussion. You can take all those discussions off of email, all those discussions out of the chat room. Listen, email and chat rooms have their place, but not in product design. InVision is like Slack, but for product design, right? So you have Slack for a general conversation. You have Gmail for asynchronous communication. You have InVision for product excellence. You cannot make a great product without InVision. I am dead serious about that. Every startup I invest in, I show it to them. They ask them to send me links, and boy, does it work. It supercharges everything you do. I love this product. I love this product. I love this product. Get out of email, get out of chat rooms, and do what Twitter, Airbnb, Evernote, Adobe, and many more are doing. Prototype what you're doing in InVision. It just makes designers and teams and founders so much more efficient. Go to invisionapp.com/twist for 90 days free. That's their starter plan, free for 90 days, only at invisionapp.com/twist, invisionapp.com/twist. And everybody thank InVision App on Twitter. I thank them for making a great product and for supporting independent media like This Week in Startups. Let's get back to this amazing episode. Hey everybody, welcome back to This Week in Startups. I'm your host, Jason Calacanis. You can follow me on Instagram. My handle is JASO. Let me check it here. N.
That's a hard one.
Jason. Is it too much to ask that you open up the Insta and you just search for @Jason and then you follow me? Or you can follow me on Twitter. Let me check that handle here in my notes. It's J, again, A, third letter S, fourth letter O, and then an N. So a J-A, then an S, followed by an O and an N.
So you're doing the most important thing, branding consistency across social channels.
Yeah, I try to pick, I have jason.tumblr.com
There you
too,
go.
but I don't know if anybody's on Tumblr anymore.
I don't know.
I don't think it matters.
Once Yahoo buys something, they leave.
I did a favor for a guy, I got that, but
Nice.
I really want to get some other ones. Like, I would like to find out who owns jason@gmail.com.
Oh, man, that'd be a good one.
That'd be a pretty good one.
Yeah.
I would like to have facebook.com/Jason. That would be pretty
Yeah.
good. I have facebook.com/inside and /launch, I think, but I don't have.
Facebook was a tough one because when they started offering the vanity URLs, they were already pretty big. So it was like in 2 seconds, things vanished. Yeah.
Yeah. So YouTube this week, at the time of the taping of this episode, it might not be when it airs, but in recent history here, in October, November time period, they launched YouTube Red. And this product is a paid service for $10 a month.
Yeah.
No ads. They'll have some premium content available. And if you have a channel and you do not agree to put your videos in red, they take you off the entire service. And because of that, ESPN has shut down all their channels temporarily. What are your thoughts on this seemingly awesome innovation and a great idea? I mean, I might actually pay to take all the ads off for our family account so my daughter doesn't have to see ads when she's watching her,
Sure.
videos on YouTube. But a little heavy-handed from the YouTube folks, huh?
Yeah, pretty heavy-handed. And generally, they're not that heavy-handed in terms of the way they deal with the creator community. So it was a little bit of a departure, I think, from the past. I mean, the product sounds awesome. I think we'll see how it plays out. But like the bottom line is, any other ways to monetize content is a good thing, I think.
You think it'll work? Do you think people will buy it? Do people want to pay for YouTube?
I think that if the creators do a good job of segmenting their content such that it truly has exclusive content on those separate channels, then yes. If it's just getting rid of the ads, I'm not so sure. And I haven't actually looked if you can granularly target your videos to your paid versus your unpaid.
Yeah, that's going to be super interesting because you either they're saying you have to be all like. So is your idea like if I had This Week in Startups, do I create a second This Week in Startups?
Correct. Yeah.
But if I don't agree to put the current This Week in Startups on the service, they turn off my free version.
Yeah, I mean,
so what would be the point of creating a second one?
Actually, you know what? As I think back, they did the same thing with mobile. They were pretty heavy-handed when it came to syndicating your videos to mobile. Although I don't think they were kicking people off the service, but they were definitely defaulting you default on.
Yeah.
For that, yeah.
For ads.
Yes, for ads on mobile. That's correct. Yep,
Right.
That's right. And I remember that a bunch of the big content creators, the traditional media guys, had problems with that.
Yeah. I mean,
we'll see.
There was always this question, and obviously I was a paid partner of YouTube's, and I was pretty vocal about how I didn't see how this was fair, that they took 45% and that they wouldn't give you access to your own subscribers. You obviously are not enamored with YouTube enough to be still working in it. Is it possible, is it worth it to try to build a business inside of YouTube? Or is YouTube just a great place to like build a brand, but you have to like be like Michelle Pham and create a line outside of it? Were you able to make YouTube work as a business, or was it just too hard?
Well, we made YouTube work as a business, but I think we were a little bit unique in that, first of all, we were part of the very first partner group. Second of all, we were doing.
What did they give you? A couple $1 million?
And I wish, not quite that much.
Hundreds of thousands of dollars.
Yeah, I mean, it was hundreds of thousands definitely over the first year or two. And then they started monetizing pretty well through ads, but then we did all of our own product placement. But we were leveraging YouTube, obviously, because we didn't.
And they let you do product placement, and you get to keep 100% of it.
We did. Now that I think has changed for people. So
now, my understanding now is if you do product placement in your videos, they'll let you do it. If the person does a $100,000 ad buy.
Media buy. Okay. Yeah.
So that was what I heard.
We were moving towards that when we were winding down the YouTube stuff we were doing. I mean, honestly, I just personally haven't been as involved directly in that space, aside, like just as a advisor to companies and things like that.
Yeah.
So
it just seems kind of miserable. Like they came out with this like stat of like, oh my God, the top 10 people made $54 million, and then it's like, well, the top guy made 12, and everybody else made whatever 4 or 5.
Yeah.
That to me was like, are you really trumpeting the fact that these people are making no money?
Yeah.
I mean, if they're making $6-7 billion a platform,
Sure.
and the number one person makes $12 million, you realize
Yeah.
how pathetic that is?
Well, especially because, like, consumers hear, oh, you're making millions of dollars a year, but they don't realize the production costs. Like,
Right.
it's very expensive to produce this content. I mean,
Thousands of dollars a minute.
Oh, yeah, at least. I mean, Kate Modern, the spinoff we did of Lonely Girl in the
Yeah.
UK, the 6-month budget was $1 million. We had 13 people running that show. It was like a mini TV show.
And a TV show of that scale would have cost, because $1 million to do whatever that was, 20 weeks, 30 weeks?
Yeah, it was about
Or was
that
it two
long.
a week or something?
Well, we were producing a video a day, Monday
Oh.
through Friday.
Oh,
Yeah.
okay.
We
So you're
changed
talking
that later, but yes, we were producing a lot of
100
content.
videos or something.
Correct,
But they
yes,
were
that's
looking in the
right.
camera kind of videos. But even still,
Yes.
100 videos, $1 million, 10,000 a
Yep,
video.
Yeah. And actually, with that show, though, we were running around town and stuff. At that point, it had gone to full cinema verite style, handheld, stuff like that.
So $10,000 a video.
Yep. Yeah.
And if you're making a $2 CPM net,
Yep.
which is what YouTube was making,
Yeah.
my God, it takes a long time, millions of views before you catch up.
That show we didn't even produce on YouTube at the time. That was with Bebo in the UK, and we
Oh,
did
Bebo.
we did all product placement. That's how we
Right.
funded that.
Got it.
Yeah.
So what do you think of Twitter now with their foray into video? I mean, I've
Yeah.
been using it, and I have to say, like, I have such a big audience there that's so interactive.
Yeah, sure.
I mean, it's resulting in hundreds to low thousands of views per video we produce.
Is this Vine or Periscope or just Twitter video?
Native Twitter video.
Twitter video,
Then we do YouTube. We do Facebook. It's high hundreds, low thousands
Yeah.
of views per video clip.
Yeah.
We'll make 5 great clips from this. You start adding those 2 up.
Sure.
Now all of a sudden, hey, maybe we get 20,000 views and then we have 100,000 for the podcast. Hey, wait a second, 20,000 views to the clips on these 2 other platforms. Like, maybe YouTube's not that important anymore.
It's definitely, it has less of a death grip than it used to, for sure. Especially with the rise of mobile. YouTube, obviously it works on mobile, but it's not a mobile native experience. Vine definitely is. Periscope definitely is.
Yeah.
And obviously Facebook. I mean, Facebook's a juggernaut. And you were asking earlier, why did YouTube take off? One of the big reasons was the community. People don't realize, but the YouTube product in the very early days had profile pages for individuals, just like MySpace did. Yeah. And becoming friends with people, there was a different action beyond subscribing to like their channel.
Yeah, you could be friends, you could talk
Correct.
to them, and people were very interactive that way.
That's right. Yeah. So I mean, it grew because it was like a video first social network.
Yeah.
And I think that they downplayed that in the product over time. It became more of just video focused.
Yeah, channels.
Correct. Yeah. And
Change
so,
channels.
And I think with the rise of Snapchat and Vine and all these other things, it's definitely a different landscape.
If you were doing Lonely Girl today, where would you do it?
I mean, I'd probably do something on Vine or Periscope. I mean, I think those platforms are just really cool. Maybe Snapchat. I mean, for me, I think a lot about the underlying technology when I'm creating narratives. So when we did the show on Bebo, Kate Modern, we actually helped design the profile pages as part of the storytelling. So I just think they're cool platforms, and I'd come up with some interesting stuff to do.
All right, let's talk about you sold the company.
Yep.
Made a little bit of cheddar.
Yeah, it was great. It was a good outcome.
Awesome. Congratulations for that. And now you moved on, and I just happened to run into you at the Scale event, which you came to, and you told me you're running this new thing, Silversheet, and I had seen it. I think maybe we traded emails, actually.
Yeah, I
we
emailed you
traded
about it,
emails,
yeah.
and I was like, hey, come to Scale.
Yep.
Check it out. What is Silversheet, and why did you create it?
So Silversheet is a platform to kind of fix the medical staff management problem in healthcare. So I created it with 2 other founders. One of them was my head of product for my last company, Pat Chung. The other is a guy I went to medical school with, David Rakoff. He's now an anesthesiologist.
So you were a doctor?
Yeah, I'm a doctor.
You still are?
I'm still a doctor.
What kind of doctor are you?
Well, I was
Dr.
a
Beckett?
I was a plastic surgery resident.
You were?
Yeah, yeah.
Did you ever practice?
I practiced for 1.5 years as an urgent care doctor because I left the surgery program.
Urgent care.
Yes.
Did you like stitch people up?
Oh yeah, sure, tons. Yeah.
In the emergency room?
Yeah, in the urgent care. Yeah.
Yeah, that is that's quite intense, is it not?
Yeah, and I have tons of crazy stories. One time, like a dad brought his kid there on Super Bowl Sunday. I was working that day, and he had eaten like a peanut butter cookie and had a peanut allergy. The kid like wasn't breathing, and I was like, "You should not be bringing this kid to this freaking strip mall." Fortunately, we got there, we stabilized him, we sent him immediately to the emergency room. Because,
Oh, you were in an urgent care facility.
yeah, like in a strip mall.
In a strip mall?
Yeah, this is like a tiny little place. You don't bring anything really bad there, right?
Like, literally, the kid was turning blue.
Oh yeah, he wasn't breathing. Yeah, we got the
Did you
crash
intubate
cart.
him?
No, we didn't have to, thankfully. We just gave him a shot of epinephrine, and then he was back.
And then he started breathing again.
He started breathing, and the paramedics were literally pulling up right at because we called 911. Yeah.
Parents are so dumb.
I was like trying to tell the guy, like, don't bring him here, but he was already like, 10
In the door.
minutes. Yeah, he was basically there. And I was like, all right, well, I don't want to divert him at this point. So
No, of course not. Yeah, and you give that EpiPen,
Yes.
People can come right back to life.
Correct,
It's
yeah.
pretty. I worked on an
It's-
ambulance. I've seen.
Oh, yeah,
this,
you've seen it, yeah.
Yeah, it's pretty
Urgent cares
crazy.
are crazy. People don't realize there's a big difference between an urgent care and an ER.
Yes.
Right, like the
you
level
guys
of
don't
care
have
is-
blood.
No, we don't have anything really. There's no CAT scans, there's no MRIs, there's no like you're not
You
doing
don't
surgery.
have blood. Number one, you don't have a surgeon.
Yep, that's
two.
right. Yep.
You can intubate people. You have an intubation kit.
You can, but most of the people there don't know how
But
to do
nobody's
it,
ever
frankly.
intubated anybody
No,
there.
yeah.
And intubating somebody is a very,
If you're not in practice, I mean, you can probably do it, but you might break a tooth or something, so it's not ideal.
it's pretty hard to intubate somebody. Everybody
Yeah.
knows how to do CPR, so that's good.
Sure, yeah.
But I mean, this is not the place, lest anybody think urgent care is the place to go. You've
Yeah.
got to go to
Just
an emergency
everybody who
room.
has kids, if you go to an emergency room.
Yeah, for sure. So you decide to go back to your roots.
Yeah, exactly. I was I left medicine. I didn't like working with patients. I didn't like the system. The healthcare system was so broken at the time. This was back in 2005. After selling the last company, I was thinking about new business ideas, and I was really excited about healthcare. I'd invested in a company called Ringadoc that was acquired by Practice Fusion. I don't know
Oh,
if you're familiar
really?
with them.
I remember Ringadoc. Yeah.
Yeah. So,
And they were just like find a doctor in your area. It's like a directory type thing.
well, they were becoming a directory. It was more of like a call answering service that they were building out
Ah.
then, like a telemedicine network. So got
I think
excited.
they may have launched at Launch Festival. I remember this Ringadoc.
It's possible. Yeah.
Yeah.
Founder's name is Jordan Michaels. He's
Yeah, I
awesome.
remember it.
Yeah.
Do you think that telemedicine is going to work?
Yeah, I do. I think for certain types of treatment, certain types of conditions. I think the question is how big will it become?
Right.
Because there's only so much you can treat remotely. But it's moving where insurance companies are now starting to reimburse, and I think that'll.
And what do you want Silversheet to do?
So we're really behind the scenes. So we're a platform for healthcare facilities to interact with their medical staff. So it's not consumer facing. It's really about the guts of healthcare, the plumbing. And we started out with a problem that every doctor faces and every healthcare facility faces, which is called medical credentialing.
Sure. Knowing
so-
the doctor has the credentials they claim,
Correct.
because doctors go from hospital to hospital, nurses as well.
Mhm.
And there are people who've had fake credentials who walk into doctors' offices with fake credentials.
Correct. Yeah, Catch Me If You Can. It doesn't
Oh,
happen.
right.
Yeah, Leonardo DiCaprio movie.
Yes, that's right. He pretended, he's like,
Yeah.
they were like, nurse, what do you think?
Yeah,
right.
exactly.
And he's
That's
just like,
probably the
"Fuck."
most famous example. But there's,
And that might have been true or no?
It's based on a true story.
Based
yeah.
on a true story.
Yeah,
I wonder
yeah,
if that's true.
Yeah.
So is your credentialing to save time and money?
Yep.
Or is it to deal with fraud and people who are bad doctors who are doctor hopping or hospital hopping?
So the reality is there's so many checks in place now that doesn't generally happen.
Hospital hopping.
Yeah, I
Is
mean,
that a term? I just made it up.
I think you just made it up, but I like
did.
it. They don't hospital hop like they used to because there's now federal programs that track everything between state lines.
Oh, a central
Yeah.
registry of
Yeah,
doctors
there's a
and where they work?
database called the Data Bank that aggregates licenses of doctors around the
Got it.
country. But what we built is a platform to automate the process. So they actually need to check a variety of sources. You have to check the state for their medical license. You have to check with the DEA for their prescriber information. There's like a dozen or so documents that you have to collect from a doctor as part of the hiring process.
Got it.
So yeah, we've automated that.
When we get back from the commercial break, I'm going to have you show us the product.
Yeah,
Because
cool.
it's always great. And how old is the product now?
We launched publicly at the end of May. Pretty
Wow.
new.
So
Yeah.
this is very fresh.
Yeah, we're
and
gonna
gonna
pilot
see
at the
we're going to see the
beginning
1.0,
You're seeing the current version that we're selling to customers. So
which
it's,
would be the 1.0.
Yeah, 1.0.
All right. When we get back, the 1.0. Hey, everybody. Let me stop for a moment, this amazing episode, and tell you about the Walker Corporate Law Group. Yes, they are a boutique law firm that specializes in the representation of entrepreneurs and startups. And Scott Walker is the founder of that company, and he is a personal friend of mine, and he does a great job working with startups. I have literally introduced him to dozens, maybe hundreds now, of startups, and they all rave about the services of the Walker Corporate Law Group because their lawyers have decades of experience. You're not going to get junior associates who are getting on-the-job training with your startup. No. They're going to help you with mergers and acquisitions, licensing, terms of service, privacy policies, formation, all this kind of stuff, fundraising, and they're really great at it. And they do fixed fees. They don't want to surprise people with crazy bills. They think that billable hours can reward inefficiency, so they'll just be fair with you. And that's what I love about them, because if you're a startup, you don't want to get that sticker shock and get a huge bill. make sure you use the Walker Corporate Law Group. And you can do that by calling Scott Walker at 415-979-9998. 415-979-9998. You can email him, Scott at walkercorporatelaw.com, or you can visit walkercorporatelaw.com as well. Scott at walkercorporatelaw.com. And let Scott Ed Walker on Twitter know, at Scott Ed Walker, know that you watch the program and you appreciate him supporting independent media like This Week in Startups. One of my oldest advertisers, one of my oldest friends in the industry, just a great guy, a total mensch, and he really takes care of the startups who work with him. Thank you, Scott Walker, for supporting This Week in Startups. Bye-bye. Okay, let's get back to this program. Come on. Hey, everybody. Welcome back to This Week in Startups. You can follow the show on Twitter at TWI Startups, as in This Week in Startups. And you can follow us on Instagram at TWI Startups. Today on the program, Miles Beckett is with us, Beckett on Twitter with 2 T's at the end. And he is the founder, probably co-founder. You got co-founders.
Co-founder,
Two
yeah.
co-founders you mentioned, of Silversheet, which is at silversheet.com and at Silversheet. And Silversheet does doctor credentialing, nurses too, or no?
Nurses too. Yeah, we
it's
added
important.
that. Yeah.
Nurse practitioners is a big deal now.
Big, yeah. Physician assistants. There's a whole bunch of associated care providers, allied healthcare.
The nurse practitioner can do 90% of what these doctors are doing
Totally, yeah.
in urgent care facilities, whatever.
Yeah.
I went to an urgent care facility, and they're like, yeah, the doctor's going to see you, whatever. And then the guy came in. He said, hey, I'm Jason or whatever. I'm the nurse practitioner.
Totally.
I was like, oh, my mom's a nurse practitioner.
Ah, nice.
They can give prescriptions.
Oh, absolutely, yeah.
With the oversight of a doctor, I
Yeah,
believe.
but in rural settings, they can actually practice without doctor's oversight.
Right. So they
Yep.
just need to have
their license.
Their license
Yeah.
and insurance and all
Yeah,
that
it's
kind of stuff.
licensed similarly to the way doctors are.
Yeah,
at this
my
point.
mom's got it.
Yeah.
So let's see the product. Yeah.
Yeah, so this is the view an administrator at a surgery center or at a hospital would see. They can see an overview of their staff. It's a really simple dashboard-like interface where they can immediately see doctors whose credentials are expiring, who have expired or are expiring soon. This is one of the big pain points in the process is that the facility is on the hook for keeping their records current,
Right.
but the doctors and nurses have to do the renewals and somehow get those documents to the centers.
So it's like I'm responsible for my driver's license,
Yep.
but the trucking company
Correct.
is responsible for knowing that I have
Yep,
it.
that's right.
And not letting me in a truck if my license expires.
That's right.
What if
Times
there's-
10.
Times 10, right. And does that happen often where the doctors forget? I mean, I can't imagine a doctor making a mistake or being forgetful.
All the time.
And so-
33% of the files we've ingested are out of compliance.
What?
Now, it's not that the doctor doesn't have the credentials.
Right.
It's just that they probably haven't sent the paper over to the
Got it.
facility.
Right.
But the facility would get dinged if they had a survey.
Ah,
So the beautiful thing about Silversheet is that it synchronizes documents similar to Dropbox
right.
between the facilities and the providers,
Got it.
in addition to providing this overview, doing verifications, and a variety of other things.
Now, this seems like to me a wedge strategy. You found
Yeah.
something that's a huge pain point
Yep, that's right.
that they're doing this all manually.
Yeah.
You go into a place, they give you $1,000 a month, $500 a month. What's the model? SaaS?
It's a SaaS model. Yeah. It's
Slightly more?
It's around that. It's several $100s a month.
Great.
Our annual contracts are about $4,000.
So there's no reason any hospital can't afford this, and they can have.
Yeah, hospitals it would be more because we charge per provider. But
Got
for
it.
the outpatient setting, the whole thesis is we want to use the outpatient setting to grow the provider network because as doctors join, then when they connect to a new facility, it just synchronizes everything.
So you
There's no
are
data
the
entry.
MySpace of doctors. I mean, I'm joking,
Sure,
obviously,
sure,
but
yeah.
it's their profile. So back to the profiles we're talking about.
Yeah.
You took some note on profiles.
Oh, absolutely.
And
yeah.
who needs to have the profile? Who maintains the profile?
Yep.
And you put it in one of the most important places in our lives.
That's correct.
the healthcare system.
That's right. Yeah, yeah. I really wanted a business. I learned a lot from my first company. Equal was a great outcome, but we were kind of figuring it out as we went. Like we started out with this huge thing, Lonely Girl. We didn't even know how to make money off of it. It took a bit to figure things out.
It was pioneering.
Yeah, I mean, we were a little ahead of the curve. So
Went out into the big blue ocean to try to find a new world.
exactly, yeah. And with this business, I had more time to think about it. And one of the things that was important to me was having something with network effects.
Got it.
So this has
Explain
very
what
strong
that is
network
to the
effects.
audience. That it was important to you
Sure.
to have a network effect.
Yeah.
And what is the network effect here?
Sure. So in the strictest definition, a network effect is the more users that use a service, the more valuable that service becomes to everybody who's using it.
Got it.
There's a different concept, which is virality, which is just things spread to other people.
The network itself grows faster
Correct.
because of some inherent feature
That lets sharing happen or whatever it might be.
which
right?
might be like if you're on Facebook, you add a friend.
Yeah.
And they're not on there, you can't find them, you put their email in and you invite them, or you
Correct,
invite
yeah.
them to a WhatsApp group or something.
Or like YouTube embeds in the early days, right?
Or
That
YouTube
was a
embeds.
viral effect. Yeah.
Yes, for sure. And the network gets more valuable every time a node is added.
That's correct, yeah.
So if you and I have a fax machine,
Yeah.
the value is
Right.
1.
Yeah, exactly.
But if Emmy award-winning producer Jackie gets one, now we each have 2 people we can send to. It doubles.
Exactly. That's right. That's exactly right. Yeah.
And then if another person gets added, there's 3 more people who can send to, and you can just see how powerful
There's
it
a
gets.
geometric progression.
Geometric
right?
progression there that is pretty amazing.
That's right.
And the internet was the greatest example of the network effect.
Of course, yeah. Yeah, so for Silversheet, as we add more doctors into the system by signing up facilities and having them load up all their medical staff, once all the doctors' credentials are there and verified, when new facilities come on board, they don't have to do the work again.
They're just like, let me just search for Beckett.
Correct.
Let me search for Dr. Calacanis.
Yep,
and
that's
it's
right.
like, oh, he's here already.
Yeah, exactly.
And when the doctors go to a new hospital, is there a way for the doctors to tell the hospital, like, hey, I am in Silversheet. Oh, you don't use Silversheet? Like,
That's
is
right.
it a bottom-up, like Yammer type system?
Yeah, that's right.
So I could start using it at my hospital without even asking the IT department?
That's correct.
For free?
Yep, that's right. Yeah, free for doctors. They can just use it on their own. And our number one source of new customers on the facility side is doctor referrals.
So the doctor just says, like, you
Yeah,
guys
like,
don't
hey,
use
why aren't you guys using Silversheet?
What you should do is you should let them use it for free for like up to 10 doctors or something.
Yeah,
For some period of time.
I know. We've thought about doing a freemium. We haven't done it yet, but we might.
There might be liability issues or something, or you just need to walk
People
them
are
through
willing to pay in healthcare, so we've been charging because
Are
we
they?
can't.
Because I thought healthcare was one of these spaces for entrepreneurs where the facilities and the players are risk averse, busy, underfunded, and they just can't seem to get that new technology embraced.
Yeah.
Or is that why your wedge strategy is so important? Because this is a weakness and it's something easy they can do.
It's the latter. I mean, so first of all, it's actually changed a bit. So younger people are now in charge of decision making in healthcare. There's definitely been a shift over the last 5 years, say. So rather than when you used to talk to people who ran surgery centers or were administrators, they would say, I hate technology, I don't understand it. Now they're like in their 30s and they're like, oh, I like technology. Why don't we have
a
this?
phone? Yeah.
Right. So there's that's number one. Number two is this is a huge pain point. They have to do it. It's required by Medicare.
Right.
It's required by all the accreditation agencies. And it's a big pain in the butt. They don't like dealing with it right now. So this just makes it all so much easier.
And I said before, maybe this is a wedge strategy of some type. Once you have every nurse practitioner, every facility in here, you call them providers, I think?
Yeah, providers more generally, yeah.
So a provider is we would consider like a storefront or a facility.
The provider is actually the doctors and nurses. Facility is the healthcare facility.
Got it.
Yep,
Okay.
yeah, so we have facilities and we have providers. Those are the two. Yeah.
Because when you say provider, I always think the insurance provider. But that's what consumers think.
That's what consumers think,
Got it. And then those are just the insurance companies.
That's right, yeah. Yeah.
Now, where do they play into all this? Do they get their mitts in here, and do they somehow factor into what you're doing with Silversheet?
Yeah, so they could down the road. So right now we're handling credentialing in the context of facility accreditation and giving doctors permission to come work there. There's another side of credentialing called provider enrollment where you're submitting the doctor to be added to an insurance roster so they can get paid by that insurance company.
Got it.
We actually have a network of urgent care facilities that are using Silversheet for the purpose of provider enrollment, and we're starting to grow that piece of the business too.
It would seem to me, as you build the LinkedIn of the healthcare system, you'll be a great place to recruit from. And also maybe, you can verify they have credentials, but can you verify their bedside manner, their ability, their, 5-star rating? Doctors right now, it's pretty amazing how beholden they are to their Yelp ratings in some cities.
Yeah.
Especially this one, San Francisco, and I think LA as well.
Sure. Yeah. Yeah. And obviously, probably Yelp is not the best place for doctor reviews, right? It just kind of happened that way naturally.
Yeah.
And actually, if you look, they've done tons of studies on outcomes, and patient reviews of doctors don't correlate at all with outcomes. The best correlate to outcomes for doctors is the number of times they perform a procedure each year. So if they do 1,000 hernia operations a year, they're probably pretty good.
How does one get that information? Is that recorded by the government, a central agency, or just the facilities?
Yeah, so both a little bit. So there was a public data set that was released by Medicare through a bunch of Freedom of Information Act requests.
Oh.
It's actually the largest set of graph data on the planet, and it happens to be in healthcare. and it has all of the information about who doctors refer patients to, like other doctors,
Oh my God.
procedures they perform, prescribing information, and that's all actually freely available.
Holy cow.
The
So
website,
that's some big data.
that's some big data. So
What is it called, the website?
it's it's if you look up Medicare graph database, you'll probably find it. Yeah, I can also send you a link to it. So that's public.
Is that how they found all these people who were doing Fugazi, like knee treatments or surgeries to run up the bills?
For Medicare fraud? Yeah. I don't know if it came through that, but there is actually a database also that has a list of everybody who's committed Medicare fraud. So Medicare cracks down on this pretty hard. That's another site that we check as part of our process.
Got it.
Yeah.
And what is your personal belief? Forget about your company for a second. Your
Sure.
personal belief on how doctors should be judged and what information should be public about what a doctor does.
Sure. I mean, I think doctors should be judged on their outcomes and their bedside manner. I mean, I think both are equally important.
Got
You know,
it.
having worked as a physician, I spent a lot of time, and I'm, a personable guy. Like, I
Yeah.
really spent a lot of time with patients. And I think that one of the most important things that you can do as a doctor is talk to the patients, reassure them, make them feel like they're part of the decision-making process. Most doctors are qualified. They're going to get the job done. It's very hard to get into medical school. It's hard to make your way through the training process. There's tons of exams. So most people are pretty good. I think most of the differentiation you see is really on the bedside manner.
Where'd you get your degree from? You didn't go to one of these like
I went to UC San Diego.
so a real school.
Yeah.
These guys and gals who go to these like schools
there's
in
some,
the
like, Caribbean schools. And
in the
stuff like
Caribbean
that. Yeah,
schools
sure.
and stuff like that.
Yeah.
Would you ever go to one of those or let a family member go to one of those doctors?
Yeah, honestly, I don't think it matters that much. At the end of the day,
You don't?
No, because people end up doing residency programs that are all the same. I have friends that went to schools in the Caribbean and they did residency programs in the U.S. and they're great doctors.
Why did they go to the Caribbean then?
It's competitive. There's not a lot of med schools. I mean, to be honest with you,
Oh, is that what it is?
Yeah, we need more medical schools.
Are
in the
those
country.
schools weak?
I didn't go to them, so I can't really say.
Right.
But like honestly, knowing the people who went, like I don't think they are. Like I know really, really smart. Like there just aren't a lot of med schools.
That's what the issue
Med
is.
schools don't make money.
They
So
lose money.
They lose money. So there's not a huge incentive to create new ones. This is part of the problem. We have a huge doctor shortage in the country. We have a huge nursing shortage. It's only getting worse. I mean, on the order of hundreds of thousands of nurses and doctors that we will need over the next, 5 to 10 years
Is
that we
it
just don't have.
a good profession today to be a nurse or a doctor compared to 20, 30, 40, 50 years ago?
I think it can be. I think the most important thing is, number one, you have to get into it because you love patient care at the end of the day.
All right, so assume you love patient care,
Yeah.
and assume the doctors for the last 50 years and the nurses have loved patient care.
Well, they haven't. That's part of the problem. I think a lot
they
of people-
haven't?
No, I mean, I think a lot of people went into medicine because they thought they could make a lot of money doing it, right? Because in the 80s and 90s, like everybody who lived in the nice houses, they were doctors,
Yes.
right? So
Why was that? Why everybody such a
reimbursement rates were high.
and something
It was
changed?
the height of fee-for-service, right? It was before HMOs. It was before any type of quality and cost reforms. So it's changed. I think that if you really love patient care, and if you take an entrepreneurial approach, even if you might work for a larger institution, I think there's opportunities for you to brand yourself, to put your name out there, to do things beyond just the patient care. The doctors that I know who are happiest have found some balance.
What do you think about this doctor on call movement that's happening? I have one of these doctor services where they'll come to my house. It's like a
Like
concierge.
Yeah, sure.
But listen, it's not cheap. But now there's a bunch of companies that I think for $100, $200, and they take insurance, will send a doctor to your house.
Sure, yeah.
And my understanding of it is that the reason why the insurance companies are so pro giving people who don't pay for a concierge doctor the same kind of service is that if they can keep one person out of the emergency room, which costs $3,000, it pays for the other 9 who don't go, or whatever.
Yeah.
What do you think about that?
Yeah, I think it's great. I mean, there's a company called Pager in New York that's doing this. There's one in LA called Heal. I like the model. I think it's great. I mean, I think it's the same as telemedicine. So there's, for both of them, I think there's only a small number of conditions that actually can be treated at home. But the reality is money gets wasted when people just go to the emergency room with something that they didn't really need to. So I'm a fan of it.
there's a huge disparity in the cost of the same procedure
Yeah.
in the same towns, in the same cities,
Sure.
in the same states, in the same country, the
Totally,
United States, and then in countries that are right around us, Canada, Mexico, whatever, Europe. What is the range? Because I've heard as much as triple,
Oh, yeah.
double, triple
Yeah,
the
maybe
cost
even more sometimes, yeah.
for like a knee surgery,
Yeah.
get a meniscus surgery.
Yeah,
One guy,
MRIs have big variability too.
$3,000 versus
Yeah.
$15,000.
Totally, yeah.
How is that possible?
It's because there hasn't, I mean, here's why. It's because the person who's buying the service, the patient,
Right.
has no idea what it costs. The person selling the service, the doctor, has no idea what it costs. So it's like going to a sandwich shop and you want to get like a roast beef sandwich and nobody knows what the price even is.
So people
and then
just
there's a
pick
third
a
party.
number.
Yeah, there's a third party that says, hey, I'll pay for the sandwich. Just pick whatever sandwich you want.
It's bedlam.
It's bedlam. So it's getting better.
How is it getting better?
okay,
Is there,
yeah.
explain to me this Obamacare, because I'm sure you know a lot about
Yeah,
this.
of course, yeah. So, I mean, the Affordable Care Act is really changing things. Number one,
Sorry, I called it Obamacare.
yeah,
I
it's
know
all right.
that's offensive.
That's
Affordable
okay.
Care Act.
Call it whatever you want.
Yeah.
It's forcing people to take costs into account through penalties, number one. And
Penalties
through,
for who?
Penalties for the healthcare facilities, for outcomes, for low outcomes, and they're basically comparing it to national norms. That's number one. Number two is they're giving incentives if they can save money. And then the third is there's this ACO model, which is kind of like a distributed HMO model, where family practitioners can become the heads of kind of like their own HMO, basically, and they get paid lump sums, and then they manage a patient population, and it's up to them to save money and manage it cost effectively.
Are any of these things working or going to work?
Here's what I'll say. I think the jury's still out. I don't think anybody can say for sure. I think it will work to an extent. Here's what I'll say. Everybody in healthcare is talking about costs and reducing costs, and everybody is talking about improving outcomes. So it's part of the conversation.
So it's definitely done something to give people a kick in the butt.
Yeah, it's changing the culture, and I think that's the first thing you have to do.
Let me ask you a personal question, not as the co-founder and CEO of Silversheet, but as Miles Beckett, MD. Do you think healthcare is a universal human right, and it should just be provided to all citizens of the United States and planet?
I do, yeah, absolutely. Yeah, it's some base amount for sure.
And do you think that makes you like a communist or like a socialist for believing that? Or do you think it just makes sense economically?
I mean, I believe in it because I care about people. And if I saw somebody dying in front of me, I wouldn't want them to just die. I'd want to take care of them or have our system take care of them.
Right.
And then also, I think it does make economic sense. If people aren't healthy, they can't work.
Right.
I mean, even with minor back pain, you know, the amount of days that people miss from back pain, it's like the biggest cause of truancy at work. Is
it really?
Yeah, it's like one of the top
I think
ones.
it's, you know what? I'll tell you why. If I say I got back pain to your boss, how do we debate that? Guess
Sure.
what? I'm not
Yeah.
doing this big in startups. Sorry, Jackie, I have back pain. My back hurts.
Yeah.
No, it is a hard one. It's typically mental, that back pain.
Oh, it is oftentimes.
I think that's a psychosomatic
Sure. Yeah,
thing
it
a
can be
lot of the time.
psychosomatic,
I know
sure.
for me, when I had back pain issues,
Sure,
it was my weight, number one,
Right.
and then it was
Yeah,
psychosomatic.
it usually is weight and stress.
And so we did this Obamacare, whatever, health plan. It seems like it's half of the existing system and half of the existing system. It's a mistake.
Compromise. Yeah, I mean, it's a compromise, right?
But is it a mistake?
I don't know. I don't think it's a mistake. I mean, it's getting people talking about costs and talking about quality, which I think matters.
See, this the thing is, though, I just think we should have done one or the other. Free market dynamics,
Right.
or
Yeah.
we just bite the bullet, everybody gets everything.
Sure, yeah.
That's what I would have been fine with that.
It's
I don't
just not
care.
politically feasible in the U.S. I mean, every other
what a
country
mess.
has a single payer model with some sort of a private insurance system layered on top. It seems like that's what works. We didn't go there. You know, we'll see what ends up happening.
I think if we get another Democrat in,
It might happen.
maybe they'll be able to, because it seems like now the net result of this Affordable Care Act
Yeah.
has been more people have health care,
Yeah, absolutely.
millions more.
Oh, millions. Oh, yeah.
And the cost has gone down,
Yes, correct.
and they don't ding you for having a precondition.
That's right. Yep.
This was, to me, I think the best part of this.
That's a godsend. I mean, people were trapped on expensive COBRA plans or other insurance plans, or they couldn't switch, or they couldn't leave jobs. I mean,
It creates a perverse
totally.
employment situation.
Correct.
You know
Yeah.
this because you're a startup founder.
Yeah. Oh, yeah.
I have people, or I have friends, and I've had employees, and I've had startups I've invested in, where the health insurance and what's provided, what's not,
Yep.
becomes the deciding factor
Totally
of
agree.
your career.
Yeah.
This is ridiculous.
It's crazy.
How on earth did healthcare get tied to employment in our country?
Well, you know, it's all from World War II.
Is it? I don't
yeah,
know.
Yeah. So I think
Educate me, Dr.
Okay,
Beckett.
so my recollection is that it had something to do with taxes on payroll, and the only way to offer extra compensation to employees was to provide health coverage because it wasn't being taxed. I think it was something related
Something
to
like that.
Yeah, it was something like that. So there wasn't a good reason.
It's such a disaster.
Oh,
I
it's
literally
a mess.
think
Yeah.
no company should provide healthcare.
Oh, I agree.
Everything should go through an open market
Yep.
where you as a citizen have to buy it.
Sure.
And then during this transition period, there's a 5-year period where
Sure.
companies have 5 years to switch over.
Gotcha. And transition people
And
off, right?
they just tell everybody, like, listen, we're going to do it in this year,
Yeah.
and it's costing you this much, and it's going to cost you this much. You have any time in the next 36 months to do this.
Yeah.
And we're going to increase your salary by the amount we're going to save, and it's completely transparent.
Totally.
And they have to give you at least the amount you were getting before.
Yeah, I like it. I think it makes. I mean, it's
I
stressful
would do it
for
in a
patients.
heartbeat.
It's stressful for patients. I mean, when you have to switch insurance companies because you've switched your employer,
Right.
you might have to switch your doctor. And you know, it's
Oh, who wants that?
who wants to do
Can
that?
you
It's
imagine you're a
terrible.
mother and you
Yeah,
have
forget
a
it. Yeah.
doctor and you're pregnant?
Yeah, forget about it.
Why would we put people through this?
I don't know. Yeah, I mean,
It's so frustrating.
it's very frustrating. Yeah.
So effing
It is
pissed
getting
off
better though.
about
I mean,
healthcare.
I am very optimistic.
You
So-
are optimistic?
Yeah, I am.
That makes me
wouldn't
feel
have-
good that you're
I wouldn't have
optimistic.
done this otherwise. I mean, when I
Okay.
left medicine, I was not optimistic.
Right, you
When I
ran
came
from it
back
to go
it,
make
that's
YouTube videos.
Correct. Now that I'm back, I'm super optimistic. I mean,
You are?
Yes,
Okay.
everybody in the system, they're embracing technology, they're embracing change. It feels like a startup scene in this big healthcare world, which is pretty cool.
What new technology do you think will have the most dramatic effect on healthcare? Will it be virtual reality, augmented reality, mobile? Will it be new drugs and medicine? Will it be DNA? What's going to be? Will it be 3D printing? Will it be robotic surgery? When you look at all the innovation going on, what do you think in our lifetime, the next 10, 20 years, is going to have the most profound impact? I'll include in that the quantified self seems to be a big trend
Sure,
too. Self-driven healthcare. There's a lot
Yeah.
going on here.
I mean, I'm biased, but I do believe this. I think the biggest change will come from IT systems.
So IT.
I do, and it's because ultimately healthcare is data driven, right? I mean, and right now the access to that data and the manipulation of that data is like pathetic compared to where,
Mainframes.
yeah, I mean, or paper files in a lot of cases, or like
Windows machines.
yeah, Windows machines. Like Windows 95 is like still in business because of healthcare.
People are using like
Faxes.
databases.
Oh, fax machines. Everyone faxes in healthcare.
How is that possible?
So if they lo-
Unbelievable.
It's crazy.
So the IT, if IT caught up,
Yes.
how much better would healthcare be?
I think dramatically.
Dramatically,
I mean,
yeah.
think about clicking a button and sending your files somewhere, and your doctor I mean, the amount of times just as a patient, things get lost when you go from one doctor to the next. And we're talking about like you get a referral to a specialist. That guy should have access to all the data. So I think we're seeing changes. It's a lot better. Like major health systems are they're all adopting EMRs because of the High Tech Act.
Yeah.
So we're seeing a lot of
EMRs,
change.
electronic medical
Medical
records.
records. That's right. Yeah. And obviously, we're playing in the other side of the equation, which is how the facilities interact with the staff.
Are we ever going to get control of these electronic medical records to the point at which I, as a consumer, would have all of my records and
Sure.
be able to do what the hell I want with them?
Yeah, I think we will.
How far?
I don't know. It feels like the never-ending quest. I mean,
Well,
like,
I
don't know.
Google made Google
Oh, I know.
Health to do this.
Yeah, everyone's tried.
And it never worked.
Yeah.
Is anybody coming close? Who's got, I mean.
Probably the best bet is going to be Epic. I mean, Epic runs the EMRs for most of the biggest healthcare systems. We'll see. It'll happen over time. I mean,
Epic
over time.
is like an old mainframe system or something?
No, I mean they're an on-premises software vendor,
Got it.
but you know they're like the state-of-the-art in EMRs.
Uh-huh.
It's very customizable. So big health systems, and they're literally paying like hundreds of millions of dollars a year for these systems. It's kind of crazy. But you know we're still at the point where if you think about before the internet, businesses adopted on-premises software.
Sure.
They automated their processes.
Shelfware.
But none of it talked to each other. Yeah, shelfware, right. Yeah. People used it a little bit, right? And then with the internet and with modern APIs, things started talking to each other. So I think we're still maybe 5 to 10 years away from that really happening in healthcare, but we're going to see the foundation laid now.
I think this is going to be very interesting with this quantified self stuff.
Oh, I agree.
When you can know your blood, readings, and you can take your own blood and do your own blood tests and do
totally.
them on a regular basis. And then you have your sleep, because I have my sleep data now.
Sure, yeah.
And I just do on a fitness basis. Everybody knows I've lost a ton of weight. Thank you for noticing.
Congrats.
Getting a little thin in the face, looking pretty good, J-Cal. And I did it by getting a Weaving scale,
Yep.
a dietitian doctor,
Yeah.
a trainer, Fitbit, and
Yeah.
a polar heartbeat. That's my brands.
Yeah.
I had the Basis watch, then I went Fitbit. I like both.
Okay.
But I'm Fitbit right now. I got the Weaving scale. And then I took all of those and I created like an email thread with my doctor, my wife, and my trainer. The 3 ladies who are making me thin.
Right.
They're all like very motivated.
They're on you.
They're on me. And I'm telling you, it's working because, but it's, they have my sleep, they have my heart
Sure.
rate, and everybody's starting to look at this. And I was like, if only there was a doctor. I have Dr. Talia, who's my, holistic doctor who does my stuff. But if I had an MD as well, like
Sure.
my primary care physician
Sure.
now, get
Yeah.
them involved. It's almost like I'm rolling my own.
Yeah.
And then it's like, well, I want to get other doctors on the thread. I just want
Yeah.
a thread.
Yeah.
I want like a Facebook feed
Yeah.
of Jason.
Yeah.
I know it's a narcissistic concept.
No, but you want that type of a quarterback, or whether it's a system or a person that can kind of bring everything together. I think there's opportunities there.
It really has motivated me, though, having like my weight and having these
Yeah.
people seeing it, and they see my workouts, they
Yeah.
see my heart rate, they know I did a workout because
Yeah.
I look and it says Jason did a workout.
Yeah.
Here's his polar heart rate. If I could have my cardiologist on there,
Yeah.
or if I don't need a cardiologist, but if I got a cardiologist,
Yeah,
they
you'd
could just
want
go
them in there too,
get in
yeah.
the thread and be like, oh yeah, Jason did these 8
Yeah.
workouts in the last 6 months.
I think we're headed there. I don't know if you've looked at Omada Health, but
No, what is that?
So they're doing this for diabetes care.
Oh.
So there's certain care categories, diabetes being one of them, where there's tons of research that shows that you really need to stay on the patients, right? If you're not on them like every day, hey, you need to not eat this, you need to work out, you need to take your insulin, et cetera, take your pills. The difference between them being compliant versus marginally non-compliant has huge changes in their future health
Marginally
outcomes.
non-compliant.
Right. To massively non-compliant.
Massively non-compliant.
Majorly changes things. So Omada has like a platform where it interacts with the patients and gets them to do it. So I think it's happening. It's happening in pockets, and we'll see over time that becoming the new way that health is done.
I'm going to make a startup out of this by the time I'm done with it.
Yeah.
Because
Yeah, you should.
I've been talking to all the people who I'm doing with, my trainer and my dietitian doctor and my wife and
Yeah.
everybody involved. And I'm just like, I could make this into a product, which
Yeah.
is you use the best of breed technology out there.
Yeah.
You go to see your doctor,
Yeah.
and the first thing your doctor does is give you the Weaving scale, set
Right.
it up. You have a common email address.
Yep.
And have the API.
Sure.
Then they put a Fitbit on you.
Yep.
Then then they get you the polar heart strap.
Yeah.
Then they get you like the videos, and then
And
you
they
do
can
a
see it
weekly
all
check-in.
and yeah.
And then everybody goes on a little SMS like thread.
I think particularly for like dieting and weight loss and exercise,
Yeah.
you need that support.
Yeah.
This is why people have personal trainers. It's not for the form. It's to like get you to go to the gym.
No, by the third time you've gone, you've got the form correct.
Right.
But it's like 11,
Yeah,
12, you did it.
exactly.
You know, it's like-
Yeah, you need that guilt to get you.
It is, yeah. Have you seen any of the virtual reality stuff of this last cohort?
I haven't, no.
This is
yeah.
something you got to take a look at.
I will take a look. Yeah, definitely. I think I love VR. I played around with like cardboard and Oculus and stuff.
Oh, so you have,
and
yeah.
Yeah. It's cool. I think it's awesome.
Here's the so I want you to educate me as somebody who did plastic surgery.
Yeah.
And you did surgery, cut people
Sure.
open. It seems to me that doing plastic surgery and doing surgery has a lot to do with dexterity and understanding anatomy and having a feel for it seems like a very physical, there's a lot of
absolutely.
physicality
Yep,
to it.
Definitely, yeah.
And if you did a VR simulation
Yeah.
and you could do, 100 nose jobs, 100
Sure.
augmentations, 100 lipos, 100 whatevers,
Yeah.
tummy tucks, could a person who was not medically trained, and I know this sounds crazy and you're a doctor,
No, go on.
but if I was not medically trained, but I happened to be the best Call of Duty player ever,
Mm-hmm.
and you put me in a simulator
Yeah.
to do the thing with the stick where they pull the fat out, the lipo.
Oh, lipo, yeah. That's not a good one to pick, but go
No,
on.
why? Because that's so...
It's all feel. That
Okay.
one's all feel because you
Okay.
can't see anything.
Right, you're just feeling the fat.
I hate that procedure.
You've done it?
Oh yeah, I mean,
What's that like? It's like you're putting it
to
into
me,
flesh.
it's one of those procedures that they do it in the outpatient setting. You know, it's very safe, but like it feels not that safe because it's a blind procedure. As a surgeon, you want to be able to see what's going on.
Because you're just taking this thing,
Yeah.
you're ripping the fat apart and sucking it out.
It's kind of gnarly.
So you feel like you could hit an artery.
Yeah.
Does that happen? People puncture something
Oh sure.
in there?
Oh yeah.
Oh yeah.
Oh, yeah.
What would be a good one? That a nose job?
Breast dog is probably a pretty good
breast
one.
dog. We'll talk breast dog.
Yeah.
So let's say I do 100 breast dogs in this virtual simulator, and then we get to the point where robotics and everything control the arms. Would I need to have a medical degree to do a breast augmentation if I just had the dexterity to do it?
So this is an interesting question. I mean, when I went to medical school, we complained endlessly about the fact that we had to memorize every metabolic pathway and every nerve and everything, right? Like, does it actually make sense for us to learn all that if we're never going to use it again?
But you had, just practicing. Yeah.
I don't know. I mean, I think that, here's what I would say. You could probably train people who are, college educated to do very specific procedures in medicine without actually going through the whole MD training process.
You could.
And part of that is the allied health profession, right? Like nurse practitioners and physician's assistants. It still is its own like broad training, but you could argue for very specific training pathways for if maybe specific procedures or certain regions of the body. But I don't know. I don't know if it's ever going to happen, first of all, from a liability standpoint.
Right. So that's
but
what
it kind of makes sense conceptually.
Liability, if we lived in a new planet where we were reconstructing everything and we just started the medical thing over. And you looked at these 25 common procedures. There are like 5 or 6 that like, this is pretty, severely intense, but there might be a dozen where it's like, if you practice this 200 times with somebody who's an expert, you literally would not need to know anything medical.
Yeah, I mean, a perfect example is hernia repairs. I forget the institution, but there's an institution that actually developed. They have a technique named after them for hernia repair, and people all around the world do this hernia repair technique. But the best outcomes are still at the center they developed it, and it's because of one reason: they do like 5,000 hernia repairs each a year. That's all they do. They do it over and over and over and over and over and over. So if you do something a million times, you're probably going to be really good at it.
Throws.
Yeah, exactly. You're going to be good at it. You do it.
See, this is where I think virtual reality simulation.
I think it can help a lot. Yeah.
Because I've been looking at it, I've been trying to figure the application.
Yeah.
Everybody makes jokes. Oh my God, adult entertainment.
Sure.
Obviously, video games. Like, these things always drive new platforms.
Of course, yeah.
But God Almighty, there are places in the world where you can't even get the damn procedure.
Yeah.
And if those, not even doctors, but or let's just say an MD who doesn't do surgery at least had the ability to go through it, and they don't have any laws there anyway about it. It's better that somebody be able to do the surgery than nothing.
Especially robotic surgeries like prostate removal. There's a bunch of urological procedures that are done with a robot.
Are they really?
Yeah, 100% robotic. They've done it for years and years and years now. And that's an example where you could easily train in a virtual reality situation and then apply it directly to a patient.
Are the robots eventually, when, God forbid you have to take your prostate out, my dad did, when those situations happen, are we getting to the point where the robot would do a better job than a human?
I don't know. I don't know actually
how
automated they are. Probably. I mean, like these things happen. There's lots of technologies that happen faster than we think, right? Like self-driving cars. They're going to be here before we even know.
Yeah, Elon Musk's like, oh, by the way, I updated the software.
Yeah, right.
Good
He
luck.
Just updated it. Like everyone's now.
Some dude drove across the country without touching the steering wheel.
Dude, it's awesome.
There's this guy who's like the guy who drives across country with his Tesla all the time, and he set the EV record of the supercharged edition. He like released a video. He's like, yeah, I didn't touch the steering wheel, but like, for like these X number of minutes.
That's sick. Yeah. So I think robotics is a category where we're going to see things go a lot faster than we think.
How long are we going to live for? You think we're going to extend our lives 10 years? People who are in their 40s right now?
Yeah, so I'm obsessed with this stuff too. So here's what I'll say. I don't think that we're the immortal generation, unfortunately.
Not immortal, but we might get an extra 5 or 10?
Yeah, I think so. Oh, yeah, sure. I think so.
So average lifespan instead of 70,
maybe goes to
goes to 85
or 90 or something like that. Here's what's going to happen, though. It's going to be like a step function, right? Like probably our kids or our kids' kids literally will be immortal, or they're going to get like 300 years. And it'll be stem cell technology.
You're not joking.
No, not at all. No, definitely not.
And it'll be stem cell technology.
Probably will be part of it.
Which these knuckleheads are trying to ban.
That's stupid, yeah. They're doing
unbelievable.
They're doing amazing stuff at Cedars. They can take blood draws from a patient in clinical practice, convert it directly into progenitor stem cells, and then they can test drugs for cancer treatments in Petri dishes. So they figure out the exact drug combination that's going to kill the cancer and not harm you. They're doing that right now.
Customized drugs.
Yeah, right now.
So that's the biggest, actually, when we think about the VR and all this nonsense. A customized drug.
I think that's going to be a big change, right? Because the way drugs are prescribed right now is we give, the same drug, at the same dose to everyone based on these massive
Crazy.
clinical trials we've done, when the reality is some people actually have completely opposite drug effects, right? Some people actually get tired when they drink caffeine. Some people go up when they take Adderall or go down. Like,
Yeah, I heard that. As
Yep.
people were like, "Oh, Adderall calms me down." I was
for
like,
yeah, if you have ADD,
Really?
it calms you down. If you don't, it makes you go up.
right. I took 4 before this episode. I don't feel the same. And Jackie, it's not working.
You seem totally normal.
Well, we put 2 in yours, and you seem pretty good
I
too.
feel good.
You
I must
feel
have
pretty
ADD.
fit.
Probably makes sense. I must have
It is really interesting. Do you think cancer will be eradicated in our lifetime? Next 30 years, 40 years? Will we have the idea of dying from cancer will be like a very edge case?
Probably not in our lifetime, but maybe in
kids.
our kids or grandkids. Yeah.
Yeah, feels that way.
Yeah, things are changing really rapidly. And it's funny, if you look at the biggest advances in healthcare now, they're more software being applied to healthcare, right?
The data.
Yeah, DNA sequencing is a perfect example where all the advances have occurred not through new reagents, not through new techniques biologically, but actually through the way the machine software is working for the replication.
Listen, Miles, I could talk to you all day. And I'm fascinated by all this healthcare. Congratulations on your success with Equal. And now with Silversheet, I think this is a great wedge strategy. I think you're going to be
Thanks.
able to get this wedge in. You get that network effect. There's a lot of different places you can start,
Totally
spreading
agree.
in.
Yeah.
Split the
Yeah,
log.
thanks.
Everybody check out silversheet.com and follow them on Twitter. That's what you're supposed to do. If you listen to the program, you hear a great entrepreneur, you shoot them an email. It's usually first name at thecompany.name.com. If you're a great developer, product person, maybe you send them a letter. I think I should work there. You're probably hiring some developers.
Oh, we're always looking for great developers.
It's a great thing to do. You might work on something like this and really save people's lives and increase make people's lives better.
Yeah.
It's nice to work on something like that, isn't it?
Yeah, that was a big thing for me too. I mean, I loved Equal. I loved working in the entertainment business, but I got kind of sick of dealing with advertising, and I was really excited about making a difference. And everybody who works at the company, they come from a diverse background, but they all really want to change healthcare and improve the lives of patients and the people that work in the system.
And look at the seed round. My goodness, Cyan Bannister, my friend.
Yeah.
Scott Bannister.
Yeah, they were
obviously,
investors in Equal as
Slow
well.
Ventures, Dave Morin, SV Angel.
Yeah.
Look at that. It's good when you got your second startup, right? It goes a lot easier.
So much easier. Very
You're like, I have a new idea. They're like, here's a couple of checks. Oh,
Yeah,
you made me
it's
money before.
literally the opposite of, the experience first time. Yeah.
Everybody takes the meeting. You're like, I have an idea. They're like, can we meet?
Yeah.
The first time you're like, I have an idea. They're like, F you, you have an idea.
And I actually...
Come back to me when you have some
Oh,
traction.
totally. Yeah, show me traction. And this time I took my time. I put my own money in it first. I really wanted to make sure that it worked before I raised money.
Oh, really? You put your own hundreds of thousands?
No, not hundreds, but
tens of thousands to make sure you had a little
That's
something.
right. I wanted to
that's
make sure
good.
it actually worked.
Yeah,
why waste anyone's time, right?
You don't want to waste anybody's time.
Yeah.
You ask people for money. Now you're on the hook.
Totally.
Now you burn the relationship out.
Yeah, of course. Yeah.
You want to do a little, and then it also makes you look good. Look like a mensch. Like, you put 50 dimes in yourself. It makes it easier for me to put money in.
Exactly. Yeah.
When I meet a founder and I'm like, how long did you put? Oh, you put some money in? Oh, yeah, I put $35,000. Like I met the founder of Butterfly. He put his own $40,000 into the camera, and I was like, are you independently wealthy? He was like, no, it's like my last 40 grand. I was like, I love you.
Yeah,
Let's go.
That's awesome. Yeah.
No, I mean, if your last 40K's in there and I'm going to
Totally.
put in 250K, let's go.
Yeah.
It makes it a lot easier.
I totally agree.
Everybody follow M. Beckett as well on the Twitter, and thank you to our sponsors and partners as well as the entire team at This Week in Startups and Launch. And thank you to our friends at WeWork. Oh, they've been a great host to us for many years here in San Francisco, and I live here now. It's a wonderful place to work, WeWork.
Yeah, it's great.
Plug and play and easy.
Yeah, it's
You got it in LA
awesome.
too.
Yeah, we do downtown.
Yeah, it's downtown. I heard it's really nice.
Yeah.
All right. This has been a great episode, and we'll see you next time. Bye-bye.